Hey everyone, Representative Evan Goike here, home after a long day in the state capitol, my first day back in the capitol in over a month. And we had in the state assembly the first ever virtual session. I went to the capitol, but I was in my office remotely, social distancing from the rest of the assembly members. And I wanted to talk about the details of legislation that was voted on today in the assembly, and then the Senate, and then on to the governor's desk if it passes the Senate. Wanted to give you a little bit of background about what was in the bill. Before I go further, I want to make it very clear that this is not enough, that this bill is not the end of our reaction and investment in stimulus and follow-up and to COVID-19 in our community. There is much, much more that the state can and should do to address both the health and the economic fallout from this outbreak. And so I voted in favor of the bill today because of some of the pieces that I'm going to talk about right now. But just know that the minute that this bill passed, the work is beginning on pushing for additional investments in different ways to direct resources to our community. It's dark out now. It's been a long day, and I'm in my home office here in Milwaukee, and apparently my office is a little, like every light I can find is on, and it's a little dark and creepy. And so we're going to forego the normal Nerd Power whiteboard or little handmade visual aids, and we're going to go ahead and thank my staff, Katie and Ryan, for figuring out how to put PowerPoint slides into this presentation so that you can actually read and follow along as I'm reviewing the bill. So here's what happened today in Wisconsin's legislative response to COVID-19. So first, a little background. The governor called a state of emergency, declared a state of emergency, and then a series of executive orders. And part of that was an initial beginning of a state legislative response. The majority party in the beginning rebuked the governor's initial offerings and introduced their own legislation. Negotiations then went forward with the minority party, the Democrats, and the majority party, the Republicans, and a number of provisions were struck and added as that negotiation went. And the ultimate product of those negotiations was Assembly Bill 1038 or Senate Bill 932, which was voted on today in the Assembly. It was introduced Monday and then voted on Tuesday, so it's very, very quick how this is happening. We've talked about a couple of different very important changes that are necessary in state law to trigger federal investment, especially on Medicaid and unemployment compensation. And so that's going to be the feature of this presentation to understand the implications of the bill that was passed by the Assembly today. And then there are other pieces of the bill that are necessary for our state agencies to administer their programs and relief during this public health emergency. First, let's talk about unemployment. Changes were made to suspend the 1 week waiting period for Wisconsin workers that are now unemployed. This means just under $10 million for the Department of Workforce Development to administer the program. But more importantly than that, under the federal legislation, the change in state law will mean that people that had to wait a week and didn't get any money for that week will now get money during that week. And that money will be retroactively applied. So anyone in Wisconsin that did have to wait for a week under this current law will get paid for that week that they weren't eligible for. That means thousands, tens of thousands of unemployed workers in Wisconsin will get extra relief, the relief that they should have been, frankly, the relief that they should have been given under state law, but it's important that right now that relief is coming. There's a provision about work share, which is important to mitigate job losses and allow people to stay at work, as well as a provision on workers' compensation for essential workers that may contract COVID-19 as part of their job. Specifically regarding healthcare, so I mentioned at the beginning or earlier the Medicaid feature. Important were suspensions of barriers to enrollment in Medicaid. So suspended co-payments, suspended premiums, monthly premiums, suspended 48-month enrollment caps. All of these things are a barrier for people in our community to get access to health care that need it through Medicaid. It also triggers hundreds of millions of dollars going back, retroactive again, back to January, that the state would now be eligible. And so it's a very meaningful both for access to the Medicaid program as well as the federal dollars that it pulls down. And that would be state dollars freed up to invest in other places. Additional provisions here in the bill that relate to healthcare involve making it a bit easier for people to get their prescription drugs refilled, kind of defining COVID-19 essentially as, I think the easiest way to think about it is as a pre-existing condition, so that people could not be discriminated against or terminated from their private insurance if they contract COVID-19, and then no cost for testing of COVID-19 from private insurers, as well as equity in any care that is quote unquote out of network. In this time of emergency, insurers can't charge you extra for that care. A number of provisions that kind of don't fall into the kind of worker category or the healthcare category. The Joint Finance Committee is given additional authority to move money from one appropriation to the other. This is not the power grab that was in the initial headlines about this bill. That was something that Democrats in the legislature negotiated out of the bill. So this does not mean that the Joint Finance Committee can strip funding from public schools or from roads. It's that they can move it from one appropriation to another to meet the needs. If there's one area that needs more money and one that may need less, the Joint Committee on Finance can make those transfers up to $75 million, and for a period of time, no more than 60 days after the public health emergency. A provision in the bill that I voted against earlier in the legislative session would reduce the number of hours for certified nurses assistants. It does draw down about $8 million of additional utilities help for low-income individuals, or housing, heating assistance, and then makes it faster to credential people that are going into healthcare, whether they were retired or out of state or just finishing their training or education, for them to get credentialed and get into the workplace. So next steps, the Assembly passed the bill. The Senate will need to vote on the bill. Then it goes to the governor. I voted for the bill. As I said earlier, the governor and the state has until Friday of this week, April 17th, to enact these changes in order to be eligible for the federal funding. So we were up against a tight timeline. If these changes don't get made, we would not be eligible for that unemployment or Medicaid resources. We're going to continue to update you as this legislation moves forward, as future legislation that's needed gets introduced and moves forward. And again, some of these changes that we've talked about continue to take advantage of the Department of Workforce Development website and their frequently asked questions page, especially on the changes to workers, to unemployment compensation. And those federal changes are coming down and will be enacted very soon. Lastly, here's my contact information. Some of the rules of how our office can communicate are going to change. However, we're still open. We're here to answer your questions, to provide as much guidance and support and feedback as we can in these difficult times. I hope this helped give you a little bit more of a breakdown of what's in the bill. Please contact me with any comments, questions, concerns, etc. Thank you so much.